These are our two most commonly used office visit, the 99213 and 99214. 99214 we use occasionally. It's pretty tough for us to get into that level unless we're dealing with complex situation. Usually patients that have had loss of consciousness for multiple minutes and have prolonged symptoms, or we can get into that level 4, but typically level 3 is where we're getting most of our reimbursement from. We're using that 25 modifier with most of our office visits, and we're really using that because we're adding on that, if they talk about other symptoms besides their headache or their concussion, that neck pain, confusion, if there's other diagnosis codes you can add in, we really find out that then you can add that 25 modifier and have success in doing that. So on top of that office visit, we're billing the 96132 neuropsychological testing eval by a physician or other qualified healthcare professional the first hour. So the way our physicians within the flow of their office, what they'll typically do is bring the patient in, their MA or medical assistant will bring the individual into the office room or the exam room. The physician will typically stop in, have a brief conversation, decide whether or not cognitively they can handle doing a post-concussion test. And then the MA will administer that post-concussion test. And then the physician will come back into the room to finish their exam and to go over the scoring. So that's kind of the algorithm of how most of our physicians choose to do it. Some that have some PAs involved or nurse practitioners in their office, some mid-levels, they will let them do the initial assessment and go ahead and start impact without initially seeing the athlete. That 96136 scoring by a physician or other qualified healthcare professional, that's if you're talking 30 minutes. And then 96138 is when the physician doesn't see them initially, we'll have the technician or the MA will go in, provide the test. Prior to the physician seeing them, we'll code that as a 96138 because they are the ones actually performing the test, the technician.